Welcome to Shifting Pathways, a place where we get real about how work is shifting. It's a conversation that brings together practitioners and leaders to make sense of how organizations are evolving, not just in mindset, but in the day-to-day realities. We talk about AI, customer experience. We also talk about operational rhythms, execution, and change management. So I'm really excited today to have a number of panelists with me who are brilliant, and they have such amazing backgrounds that can really share in the practical uses of AI while being in the different industries that they've experienced. My name is Sapna Chef, and I'm so grateful to have you all here today. I'd like to introduce our panelists. Dr. Seema is a global health leader with deep experience in maternal and newborn health systems, focused on improving outcomes at scale in low-risk settings. Seema has developed a global data standard with the U.S. Food and Administration that significantly shortened drug review timelines and improved data accuracy. Holding a PhD, her work sits at the intersection of healthcare systems, data science, and real-world execution. Seema, thank you for being here. I feel very grateful. I listened to one of her podcasts with a different one of my peers, and it was impactful. So I encourage you all to follow Dr. Seema as well. And we're joined with our global community engagement executive, Donnie Weinstein. Thank you, Mister, for being here. His extensive experience driving customer success, advocacy, and business value. Through innovative community programs, Donnie was recently the head of community at IBM. Donnie brings a proven track record in designing and executing initiatives that captivate audiences, enhance customer loyalty, and deliver measurable results, including millions in cost savings and increased retention. He is recognized for scaling customer community programs, leveraging data-driven insights, and creating meaningful customer experiences, delivering, of course, pipelines and revenue growth. I've had the opportunity to hang out with Donnie in group settings at conferences. And when we talk about community and global kind of initiatives, this is just bleeds out of him to ensure that people are not only feeling inclusive and involved, but also introducing them to each other and ensuring that the network is as rich as it can be. So thank you, Donnie, for being a part of the community professionally and for people around you.
Thank you, Sapna. Excited to be here.
I'm so happy you're here too with all these folks. Man, what can I say about Mr. Peter? I've known Peter for a number of months, plus some, and truly I've described him in this palette of warmth and excitement around what he talks about all of the time. And it's delivered in execution, and it shines through in what he does. He is the founder of IT Project Rescue, based in Atlanta. With decades of experience supporting Fortune 500 companies and rescuing distressed IT projects, he has helped clients stop budget overruns and reduce timeline delays. Peter, did you want to add anything more to that?
That you couldn't have said it better. Thank you for having me, Sapna. Look forward to this discussion.
I'm happy you're here. And we have Dr. Eva here, who is a healthcare analytics executive with over 2 decades of experience driving innovation within the life sciences and medical data industries. She specializes in transforming real-world evidence and complex sets into high-impact commercial strategies that optimize patient outcomes and business growth. A published author and frequent keynote speaker, is a recognized leader in bridging the gap between advanced data science and actionable executive decision-making. The first time I talked to you, I was like, I'm blown away. I don't even know what to say anymore. So you guys, you've got this great panelists here. This discussion is going to be so rich, and I'm so excited that you're here together. I do want to continue to just talk to you because that's my normal origin strength. I'm going to go ahead and get started. How do we build a global learning health community that can safely execute AI in real clinical workflows, not just through pilots, especially for underserved populations? This is our topic today. Panelists will explore what it takes to execute AI in healthcare beyond innovation and into real care delivery. Bringing together perspectives across maternal health, oncology, hospital leadership, and patient experience. The discussion will examine how a global learning health community can create governance, infrastructure, collaboration, and feedback loops where we need them the most, executing AI responsibly within workflows to improve outcomes and scale across diverse settings. Wonderful topic. I'd love to hear you, Seema, on what your immediate perspectives are.
Thanks, Sapna. This really resonates with me because it reflects what we see every day in the global health systems. So, if I think about maternal and newborn care, which is what I'm focused on for the past decade, I guess, is especially in low resource settings, one thing becomes very clear: we don't have a knowledge problem. Healthcare providers are trained, protocols exist, and yet outcomes don't improve as consistently as we would expect. And this gap is really about execution. What happens in the moment of care, under pressure, within the realities of that system. And that's fundamentally a behavior and systems challenge. And at the heart of that is something we don't talk about enough, and that's empathy. So unless we deeply understand the providers we are designing for, their constraints, their environment, their decision-making pressures, no solution, including AI, is going to work. So when we talk about AI in this context, I think it's important to reframe its role. So AI is not going to transform outcomes on its own. It can support decision-making, training, and feedback, but only if it's embedded into the workflows, which is trusted by providers and designed with their reality in mind. Otherwise, we risk creating more pilots that never translate into practice. So to me, the real opportunity is building a learning health system, one that continuously connects providers' data and feedback across settings so that we are not just testing solutions, but we are actually improving healthcare at scale. And that requires a much more holistic approach: technology, people, systems, and context all working together. And I've seen this version before. When I was involved in developing data standards with the US Food and Drug Administration, or the FDA, our goal was to make data interoperable across pharmaceutical biotech companies globally, which ultimately helped shorten review times and improve accuracy of new drug applications. But what made it successful wasn't just the standard, it was the alignment, adoption, and integration into real workflows. So I think there's a strong parallel here. For AI to work across geographies, we need shared foundations like data standards and global partnerships. But we also have to ensure that these solutions are adaptable, equitable, and grounded in local realities. And that's where the ethical and cultural dimensions become critical. Trust, hierarchy, gender dynamics, and local context all shape how healthcare is delivered and whether new tools, developed, will actually be used.
I'm happy. I want to break this down. Like I love that there were impactful areas that you focused on. And so I want to kind of break it down a little bit on what does the day-to-day workflow really look like when you enter into an organization and start peeling these layers back to understand it. So Donnie, do you mind sharing with me what would be your first kind of inclination as you join an organization?
Sure. So again, as someone who's built, large, communities at scale for large and small companies across in the B2B world in enterprise SaaS, but also in other ecosystems, I think a lot of the principles still apply. It's really how do you, the notion of community is really how do you bring the right people together in a virtual and an in-person room to share knowledge, with the intent of them democratizing the knowledge share so that the ecosystem can actually get better. That permeable flow of information. So it seems to me that when I commit to an organization, it's really the first 30 days is kind of doing a roadshow of being a sponge and interviewing the stakeholders and understanding what are the problems that are trying to be solved here. What are the pain points of the ecosystem, of the customers, of the business running the people business, and how are the people connected or not today, and then put together a plan about how you then bring them together in a digital ecosystem, as well as potentially through in-person events. And so in order to do that, it's not running to 1 million members in a month. It's really you start very small with, a set of trusted members and advisors. So there's clearly, a set of extremely knowledgeable practitioners that I'm sure you have access to, in addition to the patients as well as the service providers at large, where you could potentially, you're referring to a lot of these pilots, potentially put together, an assessment of some of those pilots, or even brainstorming something that could be newer, that could be then tested and iterated. But at the end of the day, it's about how do you create an environment where you can bring those resources together to share that knowledge, and that becomes an enabler for the overall ecosystem.
How would you introduce that same, if we're going to then introduce Donnie's perspective, Dr. Eva, after you get to a place where you've got this set foundation of a 30-day plan, where would you move forward next within a healthcare type of scenario? Do you see it being a little bit different? Do you see it applying in the same way?
Yeah, great question. First of all, thank you. Great insights so far from Seema and Danny. I always look from my perspective, which is data. How do we ingest the data? Where do we collect it? How representative is? And then what types of analytics do we apply? And I want to mention AI is very much ingrained already in a lot of the data collection processes, the curation processes, and ultimately how we run the analytic. But for me, it's always very important to understand this. Do I have the right population? Do I have the right consent? And how can I use that? And then also thinking about, I have multiple modes or multiple sources of data. How do I link it and make sure that patient identity is very well reconciled? So I always think about it from the perspective of where my data comes from. What is the representation? FDA is very clear that we want to make sure that we have underrepresented groups in the data. Then how do we reconcile the identity across the data sources? And then ultimately what types of analytics we deploy. Predictive analytics in healthcare data has been used for many, many years. So it's not something new, and even FDA recently updated their thoughts on what types of analytic can you use, how to validate and monitor the models, and how do you monitor data along with it to make sure that it works correctly. So that's where I always come from the perspective. The other piece that I want to mention is, which I hope we're gonna be talking about it, and I think Seema already started talking or introducing this, is the stakeholders that are using or deploying these models. Very quickly, very often, a lot of stakeholders are either skeptical, they do not have the data, they do not see the models because they're black box, and then they do not know how to validate and reconcile what they are seeing versus what actually went into the model. So what I like to doing is always understanding, do I have the right stakeholders or experts, how explainable the model is, how much I can validate it, and make it as least of a black box as I can, so then the final stakeholders using the insights can trust the data, can trust the models, and know that the models will not result in something that doesn't make sense or ultimately put, in our case, in healthcare, as patients at risk. So that's what I usually like to think about and work with my counterparts, such as IT teams, to make sure that we can resolve it, and then work with the stakeholders using the data to make sure of the insights, to make sure that they understand how the data and the analysis work are performed. Thank you.
I'm hearing it from a perspective of tech IT industries have a particular approach when they're bringing their stakeholders in. It shouldn't be much different from a healthcare's perspective. It's just that the data becomes very different, right? And so I am curious now, with everything that's been said, which is so valuable from an execution standpoint, which is why when I approached Peter about this, he said, well, healthcare is different than what I've been used to. And I said, exactly, like your experience and execution from an IT perspective is what's going to deliver a different approach and even maybe challenge some of the ways in which healthcare has thought about execution in the past. So I'd love to kind of talk about the experience that happened and now what does that transformation look like, and how from an execution mindset does all of this intertwine and come together for you?
Yeah, thanks, Sabna. Good question. So I agree with these insights so far, especially about, setting short-term goals, iterating, testing, validating, bringing in the right stakeholders, building, security in a way that protects your digital sovereignty before you do anything, I think is like key. The intellectual property, compliance, and the control of your data has to be foundational before you go ahead. That's not to put insurmountable barriers in front of things, but I think you do need to cover your estate before you move forward. But I think getting into that agile, iterative approach, I 100% agree with. But if I was going to go back to IT 101, there's a few, three-legged stools or 3-point models that I'll always go back to. There's the time, work, cost element. There's the crawl, walk, run approach, which I think we're talking about iteration, right? And there's plenty of other ones, but I think that, there's even the garbage in, garbage out hypothesis, right? We are just as exposed to risk there as we were when I started my career decades ago, right? It was true then and it's true now. And I think Seema was saying, AI is not going to somehow autonomously and miraculously solve all your problems. There are still humans in the loop. That's going to be a necessary thing. I'm watching very closely that there's a lot of propositions, a lot of tools out there that are starting to position themselves as, removing the human in the loop in their products, which is extremely interesting. And I'm holding my breath as to how that turns out. But in the domain of healthcare, I think that we would want to be very careful about that. But certainly people process technology, I think you've talked about. I think that picking use cases is going to be key. You can use AI to pick what the highest value use cases are to test with. Ones that I like are process optimization or data sanitization, things like that, where you can use it. Don't let AI do it for you. Get it to be an advisor to help you do those things. Again, an IT 101 perspective is never automate anything you don't understand. And the way I look at it is, however you apply AI, if you're getting your hypothesis wrong, if you don't have your process buttoned down, if you don't have these elements, very well understood and very well synchronized amongst the stakeholders, you'll go over a cliff. Except instead of doing it manually, you'll do it at lightning speed, right? So yep. I see that as it's very much take the opportunity. I don't think we have the luxury of sitting on the fence and waiting to see how this goes. We all have to roll up our sleeves and get involved. I think it's necessary, and you can do it in a safe way, but I think we can't lose sight of the fundamentals. That's always the case. Any project that fails that I see, people are over their skis trying to go from Stone Age to Space Age in one swipe. And I guarantee you they'll fail every time, right? I think you do need to establish your foundations and move into it. I think in an agile way in this current climate is a safe way of doing it. You should always have a North Star. Absolutely. Do your strategy as best you can. While we're strapped to this rocket, it's going to be a little hard to build a strategy, but you should do that and have that North Star in mind, however you get there. And we can talk about that in more detail, but that's my initial thoughts.
That's fantastic. I love the organic conversation, because you all are feeding from each other's points and the value that you bring based on your backgrounds. I want to challenge a little bit of what happens in an environment where there are multiple initiatives that are at different stages. And this could be even a healthcare clinic that is trying to push through regulate a highly regulated type environment, could be even global, where you are introducing the right customers, which would be the patients and the people that are receiving the care. But you're also inundated in this, we need to move the needle much faster from an AI perspective to stay innovative. So I'd love to hear whoever has some thoughts and building off of each other's perspectives on that. How would you move that, knowing, how important governance and regulations are in healthcare, with data being such a huge pivotal scare for people, especially in healthcare when it's all PI?
I can go. I think at the end of the day, I think you need to have a kind of a quarterback that's overseeing sort of the 35,000-foot view of what's going on. And so there may be things that are accelerating very quickly. There are the things that are maybe not, or maybe going down a different path. But there needs to be, ideally in a blue sky world, some dashboard that's showing, accounting for the various initiatives that are happening, number one. But number two, how far along are they? And really what are the objectives or value adds or the value that they're bringing to the ecosystem? And then really the most important thing is, what's the intersection? How do they, what interdependencies are there? And is someone taking a lens does it make sense to have 5 separate initiatives or projects, or actually can 2 of them be potentially merged? Or are there benefits or dependencies that are happening along the way that can actually drive efficiencies? And certainly, we're talking about AI and it can be very, very disruptive. I think we all need to take kind of a step back and understand how it's going to be used in each of the verticals, but maintain that what I would call the human capital to actually, there's kind of an adult in the room that's understanding, where we need to go and how it's going to be measured. Because if don't have that, it could lead to trouble, as Peter referred to earlier.
And can I add something to what Danny said? From my perspective, is always thinking about the use case, but also what is really the lowest hanging fruit that I can automate, where I know that I'm not going to be risking patient outcome, because I always think about it, how that information is going to be used by someone. And it has to be highly validated, highly repairable, and have also a very good, ability for the human in the loop. We talk about human in the loop, but it's an actual statistician or engineer or some kind of other domain expert that is coming in. And how do we motivate them and incentivize them so they don't do a check, they actually really validate that the AI is doing what they need to be doing, because ultimately AI or automation is going in to replace a task that is highly repetitive, and we know that if we automate it, a human can do something different. So I always think about that. What is the usability? What is the repeatability? How do I incentivize my PhDs so they do actually do their job versus just checking off the box, and ultimately making sure they have the appropriate guardrails that I can put in so my models don't hallucinate, because we haven't touched on it, and I'm sure everyone has an opinion on it, but these models can go out of the boundaries very quickly, ultimately impact the insights at the end. But so that's how I try to triage it, but I also want to make sure that I triage it at every step as well. It's not only that I'm going, which are the tasks, but it's also what is the sequence of them, what is the check, how my AI reconciles between them, so I know that it can say to me that there is a inability of reconcile certain steps and alert the human immediately within the process. I think we don't think about it very often. AI can be used as a validator at the same time as the human being is. So that's how I like to think about it. What can I automate it now? What is highly repairable? How can I validate it? And where AI can really step in on the validation side and help me reconcile any discrepancies that I see.
Yeah, can I add to that? I totally agree. The idea of validating everything you're doing, as stated there, it goes hand in hand with a double click from my point about strategy. You do need frameworks, and that's the thing. As Danny was saying, like there are going to be different use cases across the organization. How do you tie them together? Maybe you don't. Well, I think what you do need is a validation framework, a governance framework that allows you to select, evaluate, and prioritize use cases, protect your estate in a uniform manner, selecting tools, applying them tools in your sandbox environments, let alone how you would do it in production. All of those frameworks need to be revisited, because it's not going to be the same as like launching a CRM or some other enterprise tool. It's a whole different ball game, but you still need those governance wrappers around whatever you do. Not to slow. I think there's the balance between effective governance, but also innovation and balancing it like that. But I think it's essential that you look at it through a framework point of view that supports, as Danny said, there's going to be multiple different, use cases and different businesses, different data sets. All those kinds of variations should be able to be framed within a model that supports them all, but gives you that effective governance that's necessary for you to not sink yourself, but also continue to accelerate and build a scalable AI platform.
So, adding on to everything that Danny, Eva, and Peter have said, I'm actually going to go to now the ground reality. What happens in a low resource setting, healthcare providers, the last mile, how do they work? And especially my work I've been spending a lot of time in India, and where AI is, there's so much innovation going on, and, there are lots of tools and different things. So what we have seen there is very simple tools, some of them, but of course they have to be, what we talked about, the governance, validation, and all of those things need to happen. But how does it really help? So we have seen AI-powered vaccination tracking systems, where you're identifying under-immunized populations. We are sending reminders to mothers via WhatsApp, and it helps frontline workers to manage their schedules, right? And there are several tools like that, and I'll go over some of those. But what it does is, it's interesting, what I've seen is that these systems are not standalone. They're actually integrated into the frontline health workers and public health systems, which is what allows them to actually scale. So we have seen them going from manual tracking to real-time population level insights, from missed care to proactive outreach. So this is where AI really becomes very practical, right? It's not replacing providers. We are not looking at that, or at least not right now. But it's helping them manage the complexity and even reach patients they might otherwise miss. Whether it's AI reading an X-ray in rural clinics, whether it's detecting eye diseases like diabetic retinopathy, or using chatbots in local languages for triage and guidance. So, I mean, there is a huge potential, of course, we all agree. But how does it integrate into the system? And those use cases that we are talking about, it's not just use cases, but who is your end user? And how do you design your AI, keeping that end user in mind? And what data are you feeding it? It has to be contextual, it has to be local, it has to be very, very specific to the wherever you are going to be using it. So, yeah, so I've seen lots of improvement and using AI tools in India and how it is getting integrated. And this is just the beginning, of course.
This is why I love this, because there is a global perspective that is very intriguing for people that don't realize what the difference could be from a domestic setting to a global perspective and setting. So when we think about the way in which you are working in this community of, I still hear you saying that framework and governance is important. What I would love to hear more about is how could execution look different from that lens, where then we could bring Peter in to talk about how it could be implemented, because globally it could look different. Is there a way that we could kind of approach it from a perspective of how it could be so similar or different?
I guess I do have one question, Seema, which is especially those clinics or ecosystems that are considered low resources. Do they have a common theme today of what are the gaps? If they suddenly had a magic wand and they would say, "I wish I could have X," what would that be?
Danny, there are several gaps. I mean, there are so many gaps, right? So, and
But if you had to
we were
prioritize like the top two or three and maybe bucketize those into a theme, it may present opportunities to
sure.
become creative
Yeah.
around solutions, whether it be community or IT or analytics or all of the above.
Exactly. So in the public health system, which is where I work, it ranges from being in the big hospitals or the district hospitals, which are tertiary care centers, are in the big cities. And then you go to the really remote, rural settings, and there it's primary health clinics, which have no doctors, and they'll have only nursing staff there. So one of the biggest challenges also is that people there don't have access to quality providers, to doctors, to specialists, right? And AI is really helping there, where the nursing staff or even the doctors, general doctors who are not specialists, are able to connect with specialists using technology. And of course, that whole technology is now slowly getting replaced by AI, or it will get better and more effective using AI.
Mhm.
So that is one big challenge, is access to healthcare providers, access to specialists, right? Many of people in the rural settings do not have that. So that definitely is there. And then, of course, it's the training. So the reason I talk about training is because that's what we do, right? So the healthcare providers there in the rural settings are not very well trained, do not have the supplies, do not have the setups to do that. So we actually use simulation and team training to train them on clinical skills, but clinical skills is just one side. But we actually bring that team training and the whole communication piece, empathy in there, so that they are really confident to then take care of patients, which is where we have seen a big lag. And this whole training piece is now what we are trying to do is, you can go and train these people. We do train the trainers so that the capacity stays local even when we are gone. But bringing AI in here so that they can self-assess themselves. They can self-reflect to figure out what is it that they're missing, or what is it that they can get better at over time. And this is where we are trying to bring in AI, where we record them, they record themselves as they are doing this simulation training. They go back, they can assess those videos using a certain metrics against certain indicators, and then work again on it, right? So this is where AI is coming in, becoming really useful in bringing up the local capacity of the last mile healthcare providers. So that actually, any technology that we bring in, any tools that go in there, require a whole lot of training to go with that for them to, start using it and put it into the system. I've seen healthcare settings where they have the latest and greatest because many NGOs come and donate the equipment, and it's sitting in locked cabinets because nobody knows how to use it, nobody knows how to maintain it. And so that AI can definitely be used over there to at least bring up the local capacity in terms of training, in terms of maintaining it, in terms of scalability and sustainability.
It's so it's so different, honestly, because I have discussion is about not replacing people, it's about training people. This is not, this is about, this is the whole intention of these conversations, is to hear how frequently and how deeply you are ingraining and ensuring your people can adapt to these changes. And half of that complexity is only because people are fearful of it, don't know how to use it, aren't trained properly, don't have the right outcomes in mind of what they're going to achieve for the benefit. So I'd love to hear more about how that execution looks and from the community standpoint.
So I think that the common theme here really is very much around, democratizing information and knowledge share. And it certainly sounds, it seemed to give some great examples about how that's already being used, particularly in these remote regions where they don't have a dedicated healthcare clinician. They're getting that potential remotely. Diagnoses are being done, through AI or through, digital processes. So I think there's potentially an extrapolation of that where there's sort of the real time need, as the patient's being seen. But then, and maybe the same as this is already happening, but it's possible that there's probably an ongoing ecosystem that could be created or expanded where it really won't matter whether you're in remote or in a large city. You would have the same access to this digital ecosystem where,
Mm.
knowledge is being shared, the knowledge articles are being captured, the AI is crawling those and learning from those knowledge articles. And people can ask questions, and in many cases, those questions could be answered fairly quickly by, and it's not just people, it's the patients as well as the clinicians and practitioners, but those questions could be answered by AI. And at the same time, there's sort of this probably small population of experts that are answering or addressing questions that have yet to be answered, meaning they're creating solutions that are on the bleeding edge. And so that's something that AI has not yet learned from yet. And that's really where the heartbeat of, we talk about this all the time when I meet with other community practitioners. It's like, well, the legacy support communities are going to go away because AI was just going to crawl the ecosystem and there's not going to be any need to answer questions. Well, there's still a human population that needs to create answers to questions that have yet to be answered that AI can't answer. So I think it's really two pieces. It's how do you think about connecting everybody to the same digital ecosystem? That's number one. And number two, is there opportunity for whether you're in a large city or remote, for those practitioners to actually get together in person? Because that's also an incredibly important element of idea exchange. And how do you think about adopting AI, and how do you think about addressing the most challenging problems? We kind of call that the community everywhere ecosystem, where the legacy had been, we just needed to create an online forum. Well, really, it's now about not just the digital hub, but it's also how do you create events for, either practitioners, the doctors, the nurses, as well as, if I'm a cancer survivor or I'm a diabetic, are there regional meetups for people that have gone through and overcome? I'm a cancer survivor. I've, I've tackled, my type 2 diabetes with, through diet and exercise, things of this nature. Or I took, an experimental drug. It's not just about digital exchange, but it's also how do you create this sub community of in-person events where people actually, you know, it's about that connecting people who've gone through they have a common experience or a common desire, and they want to figure out how do they learn how to, manage a better life with the condition that they have, but also share that experience with other people so they can actually deliver, enable preventative care. And of course, that whole thing that I described, I mean, there's no boundaries on it being, India only, let's say, and then, it's people in Bangalore and Mumbai and so forth. It could be, in fact, it could be anywhere in the world. So then you could actually talk about vertical, you know what, I want to meet other cancer survivors from around the world. Those are just small examples.
Yeah. No, I love that. Community everywhere is important. And I love the way you're putting it, because it does have to start, it's got to start somewhere, but it should be everywhere. And the reality is that if it's happening at the executive level, people start learning and feeding into that and recognizing what that feels like
Hmm.
from the healthcare clinic perspective, you want your patients right in the mix of all of these solutions and understanding how does it impact them.
Mm-hmm.
Does that end up being a little bit challenging from an execution standpoint when your focus is we're delivering and we're hitting the ground running with whatever solution, automation versus and or process improvement? How does that transpire in, if we were to say, community everywhere, through an execution lens?
I'm seeing, Sutton, I'll take that one. I'm seeing some patterns emerging where you've got in enterprises with complex IT systems that are starting to adopt AI. You've got maintainers and then you've got the innovators. Or another way to look at it is you've got a brownfield or a greenfield. So some of the use cases that we've talked about here are very much in the greenfield space. They're AI native. 5 years ago, everything was cloud native, and 10 years before that, or 20 years before that, it was web first, and then it's cloud first. Now it's AI first. So in this greenfield world, AI first gets speed to market. You can test, fail fast, move on, right? And get value at scale quickly. The best way to do it is to, for example, SEMA's use case of communications out there via WhatsApp, engaging with practitioners out there in the field. Like, I would struggle on an execution standpoint to pick up legacy models, legacy systems, legacy processes to accomplish that. I think that the fast track is to do that in a more of a greenfield mode. In the fullness of time, I don't think we've had enough pattern recognition over time to see how that merges in the long run. That's going to be an open challenge. Like, how do you blend your legacy systems with these leading edge AI native solutions? That's a whole new thing. I don't think it's an insurmountable problem. You would use AI to help you do that. But, that would be a very realistic challenge. I think that it's just going to accelerate innovation at scale is ultimately the thing. Try these things, try them safely, fail fast, move on, learn from it. And then another pattern that I'm seeing is people are carving out in their, let's say, scaled agile structures, they're carving out these innovation groups that are purely focused on agentic technologies. And then it just becomes, it's still integrated with the overall product, where they would just start to roll agentic capabilities and start to execute them in the field independently, and then start to roll them into the core product. So you still have one product where elements are agentic, some aren't, but it's still the one thing. So when people log in, you can do that. One other thing is, with these small agile AI native developments, I've seen in the past, if you think about fintech, where banks that they may be in, like commercial banking or brokerage or things like that, you've got these giant, let's say Schwab's of the world, like their back end is mainframe and it's legacy, it's running on COBOL and it's this Death Star. And then you've got Robinhood comes out with AI native, cloud native, just straight to market and completely cuts their lunch with 1/100th or 1% of what all the capabilities are in a legacy bank. It's the same kind of thing in healthcare. I can't talk to the competitive nature of what's going on in healthcare, other than to say, I'm not surprised that you would have lightweight competitors coming in to solve a very niche problem using AI, right? Your user base, your partners out there are going to be fully aware of these capabilities, are probably adopting them anyway, waiting to see what the healthcare technology groups are going to do about it. Are they going to get on board with it? Are they going to partner with these new technologies? Are they going to create their own? Who's to say? But that's a complete, it's a strategy, it's a framework, it's an execution challenge, all of that.
Dr. Eva, I would love to hear what your perspective is on that.
Yeah, sure. Thank you so much. Great points by Peter. So I want to maybe go back a little bit and comment on a couple aspects. First of all, I always look from data and analytics components and how do I then advise those who are going to be executing, whether it's clinical or it's commercial. And commercial, we are thinking about pharmaceuticals, then developing or deploying strategies to improve their outreach to patients and then promotional activities. So I always think about it. The data is there are very different rules in Europe, in EU versus whereas in US, and that applies also to AI and how do you deploy it. So if I'm working at the States, I work at the patient level data and I can do analytics clearly supporting all of the privacy compliance governance frameworks and identity reconciliation, but I'm working at a very different level of granularity. So all my models and my governance has to also make sure that, and all my training has to be that level to make sure that there's no PHI being disposed at any single level. When we are thinking about training models, then based off what usually happens, right? It's US data or US developed models, and they are being shared over to EU and other countries where privacy concerns are for different granularity, doesn't get at the same level, and then they deploy them, test them, so that's some kind of federated like but country um, control type of system where they take those coefficients and they run it on their side. So AI never actually goes in and runs it on their data. It just uses the insights and then comes back to the federated piece. It reapplies it everything and then sends back. That actually model allows, which is not very old, and probably Peter and Danny can comment on it, but probably a year or two, AI doesn't ever sit on your data. It only provides the logic and which ultimately supports privacy constraints that are set in US, as well as any constraints that federal agencies in the United States might have, because it never goes into the actual fork. It always applies it in. And I think that is very important piece. The other piece that I want to mention is we didn't talk a lot here. It's mostly about the execution, but also I want to mention that where providers are leveraging I guess predictive analytics as well as AI-derived inputs is really supporting their decisions. So FDA did approve a framework where the models can be deployed, the physicians ultimately or providers ultimately responsible for making the last decision, meaning you just don't take it blindly. And I think that gives that component, improves. I love what Seema said, and gets into the situation with rural America where access to care is very limited. So we are doing telemedicine. So everything has to go through AI or some kind of technologies that are responsive to those questions, but then also gives the provider on the other side, even if they're thousands miles away, ability to actually approve the system, approve the actual action, and then do the deployment. So I do want to think about it more broadly, but also think about it, what does it mean for each country, as well as how do we deploy it outside of that. And the last thing that I want to mention is AI and technologies have been in healthcare for a long time. I don't know how many of you have seen robotics, the Da Vinci surgical equipment. I actually had a chance to play around with it in late October, and it's really remarkable how easy that is, but also how precise it becomes. So the ability to deploy those and make patient safety better, patients outcomes better, it's actually so remarkable. So I always want to say technology is great. We need to push it forward with appropriate guardrails, pragmatic use, and then making sure that we decipher the insights and populate to the countries where privacy might be much more restrained. Thank you.
It's interesting to be able to hear you all because you come from very strong perspectives, but yet we still land somewhere in the middle together, right? There's some frameworks, there's the governance, there's the importance of, ensuring that your community is involved. And I think from a global perspective, I'm still in awe by the fact that, their approach is very much around training their people and ensuring that people understand what this looks like. And so I just want to bring, one more thought. I know we have just 6 minutes and I'll close at the end, but I just want to ask each of your perspectives. If somebody comes to you and actually says, this isn't going to be viable for healthcare, I don't want AI solutions to be a part of the care that people give. I want you to come in. I want you to essentially execute on making me this much by the end of the year. I don't know what you're going to put in the middle, but I need my community to understand it and be trained on it. Truly, where do you believe that your approach would be the first kind of gut ability to move the needle forward when we talk about you got to be innovative with AI solutions? I hope that question makes sense and kind of delivers what I'm looking for quick snippets from each of you. Can we start with you, Donnie or Peter? I don't know, whoever's not on mute.
I'd love to have a go at that one if you don't mind.
Go ahead, Peter.
So, in the, I guess, decades now of my time in IT, there's always new technology. There was cloud computing, there was social media, there was I was there when the internet started to come out and became ubiquitous, all these things, and all the same panic strokes. It's all the same thing, like getting fired, like all these, there's going to be like your jobs are going to disappear. and all of the other hysteria that happens, it's the same. It's like, I've seen this movie before. What I did with my career, and it's all about mindset, Sapna. So my advice to anyone is, like, you've got to have a mindset of adapt or die. You have to transform. You've got to get on board and learn these things and be willing to transform. You're like, there is no such thing as job security that you don't create for yourself, right? And so those days are over. You do need to get with the program and transform and adapt to these new technologies. It was true 25 years ago. It's true today. Like, the game hasn't changed. It just happens to be called AI. It's the new hot thing. 15 years ago, it was social media. Like, here we are, right? That's it. And it's a mindset thing. And I've seen people panic, and I've seen people implode, not willing to adapt and thinking that you can just, be a Crystal Reports developer from the 90s and keep your job. Like, it's not going to happen, right? Like, I've seen it 100 times. The only people that remain viable are the ones that adapt and shape themselves. And I'm not getting any younger, and I'm doing it again for the 5th time in my career, right? So that's my 2 bobs worth, mindset for sure.
That's great. Great advice. So I was just at a conference last week, actually one in Atlanta, which was very focused on CRM. And, Esteban Kolsky is a good friend of mine. He's a thought leader in this space for many, many years. And he had a phenomenal presentation. His analogy is that we are seeing what is equivalent to the introduction of the home PC back in the 80s and 90s, but at a much larger scale. It is a new tool to be used, and you either use it or you lose it, because if you don't embrace it as a tool to make your life and work better, you're going to be left behind. So that's the first piece from the tech side. From the community side, this whole mindset of, I've got to scale to 1 million members, within 6 months is a bunch of nonsense. If you have 5 people that are incredibly high quality and providing super rich content and engaged, that's enough to start. And so I think that's kind of the if you're going to come in and have a quick win, it's really getting to that incubator of having a small but mighty cohort to actually have engaged conversations, come up with ideas, come up with solutions. And once that starts happening, the numbers will flow, but it will come thereafter. And so again, the value that'll be provided in the interim will be great. And again, as the word gets out about the value of those conversations, it'll bring more people on.
If I may add, I 100% agree with what both Danny and Peter said. AI is here. And to be honest, AI has been here. We just all of a sudden, we all talk about AI because it became with generative AI the big thing. But predictive analytics, machine learning, and visual models and so forth, they've been there for a long time. And many of us have been in the industry, in healthcare industry, have been using them, whether it's on the radiology side, whether it's predictive analytics on patient finding and so forth. So for me, when I work with teams, I always say it is here, it's been here. We have to keep adapting, but also think about it, what you can do with the time that is now saved because you don't have to do certain tasks. I always want to think about it, how can we develop further with this, and what else can we do? Clearly now we can do way more once we automate it correctly and monitor and govern in the right way. But it's also an opportunity now to think about it. How do we extend it? How do we include other data sources? What types of other analytics we're going to be doing to provide the insight? So from me, I always want to look at the best part of it and talk to my team saying, if you're not going to be here, if you're not going to adopt it, you are going to be left behind. Unfortunately, that's what's going to happen, right? This is the ship has already, or the train has already left the station. We are all on it, and we have to adjust. And I think that's the mentality needs to change. And those that I want to say for anyone listening, whether it's healthcare, technology, or any other finance, this is already there. We all have to realize it and go with it. We're going to be left behind, unfortunately, for us. Thank you.
Yeah, and I agree with all of that. And I would just add, AI is a technology, right? And we have seen so many new technologies come in, and we have all adapted. So the thing is, either we master the technology, or otherwise technology will master us, and then we'll be the slaves to technology. So it's best to, move forward and adapt it. And, that's how most technologies we have dealt with. And I know, Eva, you talked about Da Vinci here from Intuitive Surgical. And I just listened to Dr. Catherine, who is the president of Intuitive Foundation. And what they are focusing on actually using AI and simulation to train healthcare providers in resource-constrained countries. Because again, you have Da Vinci, how many people know how to use it? Or how do you make it easier for people in the last mile, healthcare providers to use it? So that's where they are using AI. So I go back to this using AI for actually building the capacity of the local healthcare providers in the resource constrained communities. And it's such an effective tool and has a lot of promise and a lot of potential. And as Danny said, it is going to democratize information, democratize healthcare, democratize technology. So I would say that AI is here to stay, of course, and grow. And it's best for us to use it and use it for the better of the world in every case and in every situation. Yeah, that's what I would add.
This is beautiful. You all are so appreciated. I want to, let people know in the audience that who will listen to this, that AI is meant to be a tool. It's not an entire transformation. It's meant to bring your people along and ensure that your people understand and can adopt to what's about to happen. I often say, well, social media wasn't so bold and big back then when the internet came out, right? So now we're using the social media to enhance the technology by saying, hey, everybody, look at this, look what I can do. And for people that are not used to that sort of rigor behind technology, immediately feel this taken aback and what's going to happen to me, and start feeling a little lost. And so the intention of these conversations is that people can come in and listen to your experiences and your background and feel a sense of security and safety and understanding of what this means, that it isn't supposed to scare them away. It is meant to innovate and make them more whole. I just can't get away from the community everywhere, Donnie. I just think that's so beautiful. So I appreciate you all. Thank you for being a part of Shifting Pathways and for coming together in such a beautiful way. Please stay on for a moment. I'll stop the recording. Thank you. Thank you for joining us. If this resonated, connect with these panelists and me, and keep coming back to Shifting Pathways for more conversations. Practical, honest, and built for how work is changing.